It's Thursday, November 14th, 2019. Digital Trends Live is about to start here. Some of the topics we're covering today. What's old is new as Motorola unveils a brand new foldable Razr phone that is a bit of an upgrade of the classic version. We'll walk through the features and the price for the new release. And joining me in studio today will be Bryce Olson, the global strategist in Intel's Health and Life Sciences Group, to talk about using genomic sequencing to find better treatments for illnesses. And the rollout of 5G is clearly key to our technological future, and we'll discuss 3D printing ceramic antennas to relay the signals with XJet's Chief Business Officer, Dror Denai. And we'll have some space news as the Japanese Space Agency's Hayabusa 2 probe that was sent to an asteroid to shoot a projectile into it is now on its way back home carrying a sample of the Ryugu asteroid. All that and more on today's Digital Trends Live. As evidenced by that tease, we like to pack in as much tech news as possible during the show, and we have a lot for you. Hello, everyone. This is Digital Trends Live, broadcasting live here every weekday, bringing you tech headlines, news, interviews, and discussions, and so much more. And we are broadcasting live from the Samsung QLED 4K studio, and since we are live, we're on a number of different platforms. We're on Periscope, Twitter, Twitch, Facebook, LinkedIn, YouTube, Dailymotion, Apple News, 2 different mobile apps, a smart television app, and at digitaltrends.com/live. So wherever you're finding us, you can drop in your comments, your questions, join in the show. It's interactive. We want to see what you have to say about all the cool things we're going to be talking about. But to start off, I'm Greg Nibbler with Riley Wynn.
Hey.
Hey.
Glad to be here. Glad to be here.
Indeed, and I know you are excited about the topics that we're going to be
I am. I'm really excited about all the topics we're covering today.
Well, we've got a lot to pack in a short amount of time, so let's get to it. The first thing is this. It's the biggest trending story that's out there right now, and it has to do with Motorola releasing a Razr phone, which normally you would think, okay, that's a huge news, I don't understand. But no, this is the foldable Razr phone, the foldable screen Razr phone that we've been kind of anticipating for a long time. They have finally rolled it out, and we have it. So we were actually able to, Corey Gaskin was able to go down and take a look at it. We've got a hands-on review of it. And I want to know from you, Riley, what do you think about this?
So the original Razr was actually my first cell phone.
Really?
Growing up, yes. So I am really excited about this. I was like, looking at the pictures of this, it looks so sexy, it looks so awesome. The only thing I had an issue with when I learned more about the actual phone was the specs.
Yeah?
They were a little lackluster. But that thing, like, look at that. Look how
it
beautiful.
Does look cool.
It's so pretty, so thin, and just like all the nostalgia of like, because I remember I got it in 8th grade. I only got it because my brother like went out of the country, so I got his old cell phone.
Nice.
And it was just like so many memories. The only thing I want on this one though, it has to have Snake.
Yeah, you would think that they'd roll out as part of the campaign, roll out some classic games on it.
It's gotta have Snake on it.
Minefield maybe, yeah, definitely needs to have that. But I love this idea of this phone itself. I mean, talking about the actual screens, so it's got an OLED screen, foldable, folds out OLED screen, and then it also has another screen on the front of it.
Yes.
So when you do fold it down, that's also a pretty cool feature.
Yeah, like you can still use it. It's a smaller screen. You can't have all the normal functions of like the big foldable screen,
right?
But you still can like answer texts, emails, things like that. And it's funny where the camera is. I think that is going to like throw a lot of people off. That's not normally where cameras are on phones now.
Right.
And there's only one camera. Most phones have 2 to 3.
Have a whole bunch of them.
Or 5, like,
right.
We have so many cameras on our phones now.
And that's the trend, it's the more the better.
Yeah.
Everybody's got to have, 4 different ones on there, and then, 19,000 megapixels. But this one, with this, I mean, the foldable side, actually, what I'm really interested in when it comes to this kind of technology and seeing what the companies do, is that small screen. Mm-hmm. Like, what do you do with it? Other than, you got your time on there, I guess you could read some quick messages, but they're talking about maybe having developers come up with different solutions for that, or different things that you can utilize it for.
Ooh.
That's cool stuff.
Instead of just using like voice activation, like some different like gesture control or something like that,
or something else, with that screen, with that real estate that you have on that small screen, something else that you could do with it. I think that's where the real innovation is going to show up.
Yeah, I like the fact that when it folds up too, compared to like the Galaxy X and the who else, Huawei and
Huawei's got one. There's the
Honor Royal.
The Royal Flex Pi.
Yeah, Royal Flex Pi.
Yeah.
So those ones, when they fold up like ice cream sandwich-wise,
Yeah.
This one folds up this way, and it looks like it gets really small when it folds up, which I like, because phones are kind of big and bulky in your pocket nowadays.
Right.
Compared to like back when you had a flip phone, it was this big.
And that's something that actually a foldable phone can solve. Like, that's a real problem.
Yeah.
You know, that this could be a solution for. So it is pretty cool in that aspect. One thing, the price, it's expensive. And all of these new foldable devices are expensive. It's not as much as the Samsung Galaxy Fold, but still $1,500.
Yeah, so it's $500 more than the iPhone right now. But it's what? $1,000 less than the Galaxy X, isn't the 2,500 or something like that?
2,000, I think, is where it ended up being. But yeah, it's very expensive.
Crazy expensive for a phone. And like Corey, our mobile editor, he's saying that like for this phone to be $1,500, it needs to have high-tech specs, and it doesn't.
Yeah.
Like, it doesn't have the new Snapdragon Qualcomm chip. The camera is not as great as other cameras. It's only one camera.
6 gigs of RAM, 128 gigs of internal, and no micro SD slot, so you can't expand it.
Exactly.
Yeah, and if you're paying $1,500, you definitely want those features.
Of course, of course.
So
a lot of money.
It's definitely going to be, I think, more of a novelty right now. But if we see this start trending more and more to where we're going to see some other companies developing it, I think leading up to CES, we're going to see more foldable devices start rolling out. Because now that Samsung's done it, Huawei's got theirs. Now you're seeing the Motorola start rolling out. I would not be surprised if LG came out with one pretty soon, and some of the other big manufacturers that they're going to start making these. And that means the price can go down.
Yeah, which I really look forward to. This has been the foldable phone that I have been most excited about.
Nice.
Just because I think of the nostalgia and everything. The other ones, like, I didn't think the Fold would be that cool. But this one, I don't even think of it as a fold phone. I think of it as a flip phone.
Right.
With a badass
it's
screen.
still fun. Yeah, do the whole flip out. Yeah. Flip the phone out.
Yeah.
And it's fun. Well, we've got all the details about it. You can check it all out at digitaltrends.com. And we've got some more videos. I believe we have a hands-on that just went up on YouTube earlier today. So you can check that out as well. And let us know what you think about the foldable phone. I do see some comments coming in here. People are questioning the affordable aspect of it. Keelan says, I'm not paying $1,500 for a folding BlackBerry. So maybe BlackBerry's going to be coming back.
I mean, BlackBerry's also had Snake, so.
That's true. So
how much are you willing to pay for Snake?
Worth it. All right, check that out at digitaltrends.com. Continuing on, let's talk about some more streaming services and everything that's going on with this. So many different companies are offering services now, and Apple being one of the ones really jumping into the game. They have Apple News, you have your Apple Podcast, and of course, Apple TV Plus. But what about bundling them all together in one super bundle? With possibly hardware involved too. And that's what the thought is right now. There's a report from Bloomberg talking about this, that this may be something Apple's going to go toward. Apple TV Plus just launched, it was just at the beginning, a couple weeks ago. It feels like it was months ago, but it was really just a couple of weeks ago that launched. And they did their rebrand with Apple Music, Apple Podcasts, Apple News, and there's a service for Apple News. I think it's Apple News Plus that you can get. And talking about putting all these in together, do you think that's a good idea or a bad idea? Would you be more inclined to subscribe to one of these if you get them all?
Well, we've talked I don't like paying for music to begin with, so I probably would never get Apple Music. But I can see why people would want a bundle. It totally makes sense at the right price point. Because, I mean, Apple News Plus is $10 a month. Apple Music's $10 a month. Arcade's $5 a month. Apple TV Plus is $5 a month. So if you add all that up, it's kind of, I don't think worth it. But if you can get it down to like a $10 or $20 price point for all of that, I think people will be like, heck yeah, I'm going to do this. Especially if they start to include the iPhone hardware and thing like that.
The hardware upgrade, I think, would be the really interesting part of this, because Tim Cook even mentioned, he's like, people basically look at it, and I'm paraphrasing, but basically people look at your phone as a rental anyway, because you're doing it through a service, so you get your upgrade, so why not maybe figure out a way that they could capitalize on that to where you're actually just leasing the phone from Apple or renting it or part of a subscription service. So what do you think about that? I want to know what people, how people feel about that, and whether that's something that you'd be interested in, because I think we're going to start to see more and more of these bundles.
I agree. These companies are going to start to create their own ecosystems, essentially, where they just want you to stay in their bubble. And Apple's actually been doing that for a while, to be honest, like with the iPhone, their computers, things like that. Now it's just going to go all over the place. They're going to include like cloud storage, possibly.
Right, possibly.
So there's just so many things that like Apple does that people use all the time. And so if you can just pay for all of it at one time rather than having to bill here, bill there, I think people will be for it.
Yeah, and what do you think? I mean, it's kind of following that Amazon lead.
I mean, if you like the ecosystem that you're in, why not?
Well, and I feel
buying
like
completely. You know what I mean? Like we
Yeah.
have the Apple fanboys, we have the Google and Android fanboys.
Yeah, I was gonna say for Apple in particular, this seems like something that's geared right to their crowd. And you know it. I mean, if you're out there, if you're a hardcore Apple user, you want all of the Apple products, and if that's going into their services as well, why not throw it all in? It seems like a good idea, and I think the more, especially when it comes to the TV side of things, the more companies we see getting into the television streaming business, it's going to start contracting at some point.
Yeah.
I think we're going to start seeing some more bundles like this. This could be something that we see more of. So that's what we're looking at right now with Apple possibly creating super bundles. Super bundles.
Only going to get it if it's called Super Bundle.
Yeah, it's got to be called Super Bundle. Super Bundle Max Pro Plus. All right, check that out at digitaltrends.com and let us know what you think about that concept. Let's continue on with some more news, and this is a trending story. It has to do with the evolution of electric vehicles, and Ford definitely getting into the game. They've been talking about it for a long time with some new things that are going to be coming out. The Ford F-150E version may be coming out next year, maybe the year after. We don't have a real solid date on that, but we do know now that we're going to have an E Mustang, and we have the name for it. And this is what it is. It's the Mach-E, the Ford Mustang Mach-E, and it's not actually a Mustang. It's inspired by a Mustang. So there's a couple of things with this where, and we had talked about this, I believe last week actually, how this was going to be coming out, but we didn't have the name. So now we have the name, the Mach-E. It's going to be unveiled on November 17th in LA, ahead of the LA Auto Show, and you're going to be able to place an order for it, I guess, right away when that happens.
Yeah, you can put down a $500 refundable deposit right after.
Oh, that's key.
Yes. So put down $500, you will get it back even if you don't like the car. So
Yeah.
that's nice. I think it's going to be sexy. Like,
You think so?
I love the name. I absolutely.
Mach-E?
Mustang Mach-E just sounds like, sounds fast.
It does sound fast. I think it's a little bit of a risk to capitalize on the Mustang name. Because
that's
Mustang
true.
hardcore fans, and maybe that's not a big enough of a slice of the pie for Ford that they're not worried about it, to where people are going to be like, you can't ruin the Mustang name. But I mean, if it can't back up some of the things that you get out of a Mustang, then I feel like that's going to.
I totally agree, because you're right. They are hardcore fans. It was funny. They actually wanted to name it the Mustang Mach, just like straight up. But they had angry fans because there was the Mustang Mach 1 from the late 1960s, I think it was, and they had so much outlash, and people were like, "No, you're not doing that." So they had to change it a little bit, we're gonna call it the Mach-E, not just the Mach. So
yeah, I mean, and
their fans are crazy.
Fans are, and you have to talk about who they're going for.
Yeah.
Who's this market? And is it going against maybe the Tesla market? It's probably definitely someone, because it's an SUV too. We didn't go into that part. So it is an SUV.
It looks nothing like a Mustang.
Yeah, and that's the thing.
It's
Which is why
it throws you off. It throws you off. Mustang's in the name, but it's not a Mustang. It's an SUV.
Yeah.
It's electric. All I want it to have from the Mustang is the cool taillights and then the headlights. That's all I care about.
Yeah, that's pretty cool. I mean, Mustangs are cool. I'm not gonna lie, they're pretty badass. But talking about this one, so November 17th, that's when it's gonna be rolling out. So we'll have coverage of it. We'll be at the event. They're holding a huge event for it. So we'll have that. It's gonna be live streaming and all kinds of things. But yeah, that's the Mustang Mach-E. So this is the latest entrant. We're gonna see a lot more of this going forward, because every auto manufacturer's getting into the game. But you can check that out at digitaltrends.com. I know we need to get to our break. But we have one more thing that we got to bring up, and that is going back to Apple.
Yes.
Something that they have launched, and they talked about this earlier in the year at their event, but it is actually health study apps. So they've got 3 different ones that they put out.
Yes, it's the Women's Study, Heart and Health, I believe is what it's called. Or
Yes.
Heart and Motion, something like that.
Heart and Movement. Yep.
Movement, and then what's the third one?
The cycle tracking app.
Cycle tracking.
Yeah. So, or it draws from the cycle tracking app.
Got it.
Excuse me. It's a hearing study app. I want to make
Hearing
sure I get
study,
that
that's
right.
what it was.
Let's reset that. So we've got the Women's Health Study app, we've got a Heart and Movement Study app, and then a Hearing Study app. So they're all inspired by the cycle tracking app on Watch OS 6. So the goal of this, though, is to help gather data for science. They said, of course, you're not going to use any of your private data. You do have to opt in to use this, but compiling all of that data, they think that they can actually help out health studies.
Yeah, I think it's a good thing. I think the Apple Watch is a great piece of technology in monitoring health. If I had an Apple Watch, I would totally opt into the hearing study, because I actually think I have pretty bad hearing. So it'd be nice to see if I actually can confirm or not.
Confirm or deny it?
Yeah, confirm or deny that I actually have bad hearing. But it's just a great piece of technology. The only thing, though, is, man, all that medical information. Like,
That's a lot of
it's
data.
a lot of data about you, and very personal and private data.
Yeah. And that's something that I think a lot of people are going to be concerned with, especially nowadays with how much data is such a huge issue of what companies have. That is definitely a concern. But you can check that out, digitaltrends.com. I know we need to get into a break here, but you can read about everything we're talking about right at the website and follow and stay up to date with everything that's going on in the world of tech. Riley, thank you.
Hey, thanks for having me.
Always fun. So we, like we said, a lot coming up. So coming up next, we have Bryce Olson, who's the global strategist in Intel's Health and Life Sciences Group, who's going to be here in studio with me to talk about genomic sequencing and what kind of advantages and benefits that can have for all kinds of things. So really excited about that discussion. Drop in your comments, your questions. Back here in a minute with more Digital Trends Live.
Apollo 11, your go for separation.
TV is making history again. The groundbreaking Samsung QLED 8K.
Welcome back to Digital Trends Live. Thank you for joining us. We broadcast live here every weekday, 9 a.m. Pacific, noon Eastern, bringing you tech headlines, news, interviews, and discussions. And I'm very excited about the discussion we're about to have right now. Certainly, using technology to improve lives is so important. And we're talking to somebody who's at the forefront of that and more. We have Bryce Olson with us right now, who is global strategist in Intel's Health and Life Sciences Group.
Hi. Yeah,
Hello.
That's right. How are you?
Doing well. Cool. That's a mouthful of a title, so I want to make sure I get
that is
right.
a mouthful of a title.
Well, let's walk through what that means, and I have to get into talking about your shirt. But to give everybody out there just a little bit of a description, can you talk about what it is that you do?
Yeah. Well, so I'm basically our global strategist. So I look at, the different markets that are in the healthcare space: providers, payers, pharmaceutical companies, cancer researchers, and how do they take massive amounts of data and find new interesting patterns that are hidden that you need technologies like AI to find.
Yeah,
and
I mean, we're in such an era of all of that data that it feels like we're kind of at the forefront of what can we do with all of it.
Exactly. And some of the areas, just if you look at genomics data, it's arguably the biggest of big data. Genomics is essentially, let's understand what's driving somebody's disease in the DNA.
Wow.
But DNA is 3 billion base pairs, 6 billion letters of stringing the stuff together and then finding the needle in the haystack that might be driving your disease. That can be transformational. I mean, that's the reason why I'm here right now.
Yeah, and that's what I wanted to talk about your backstory too, just to give everybody some context of what you went through.
Yeah, well, so I got diagnosed with super aggressive metastatic prostate cancer back in 2014. And I went through the one-size-fits-all. Everybody gets the same trial and error treatment paradigm we're in today. Yeah, it's surgery, chemo, radiation.
Yeah.
It's and that didn't get it done. It extended my life a little bit, but by early 2015, cancer was coming back again. My median survival was about 2 years.
Oh, man.
And I started to go into a little bit of a dark place. I didn't think I'd see my kid get out of elementary school.
Yeah.
And I was coming off a leave. I wanted my last days to matter. I knew Intel had this group that was working with the health and life sciences sector. I dug into what they were doing, and then I was like, I got to get in this. This could be really interesting. If I could help use my background to help some of these companies, find something that could just be life-saving, then I got to get in. But what blew my mind was genomics.
Yeah.
We were working with some of the largest genomic research, cancer research companies, pharmaceutical companies that were trying to understand like what is driving because cancer is not one disease. Even prostate cancer is not one thing. Everybody is unique. So unless you understand what's driving your disease in the DNA, then you're not opening up new doors that could actually save your life.
And like you mentioned, that blanket treatment that everybody gets, that's not going to solve it. I mean, it didn't solve it for you.
Right. So, fortunately, I had a front row seat of watching Intel work with all these major genomic research centers, helping them discover this. And then I was like, WTF, why am I not getting this, right? So I went to my academic cancer center and I was just like, sequence me. Let's do this. I want to understand what's driving my disease so I can open up new doors, get onto a targeted drug or an immunotherapy drug that would be a better fit for me and less toxic. And it worked. That's what I did.
I mean, that's such an incredible story, and you had access to that to be able to do that, and clearly knew what you were doing in order to get that sequencing. So going from there, what helped you? How do we get this out to more people?
Yeah, so it's a great question, right? Like, this is one of these weird things where technology and science is moving at exponential rates.
Yeah.
The healthcare industry is moving at linear rates. Right? So I've kind of live in this tension between exhilaration of seeing all these amazing discoveries that are happening in research and then trying to drag them into the clinic. It's like I described recently, it's like Inspector Clouseau when he's trying to get into the castle and he keeps falling in the moat.
Yeah.
I'm trying to bring this into the castle, but it's a slow grind. And so I think what we need to do is like wake up patients like me. If you have an advanced cancer and you are running out of options and you're not getting new doors opened, start to demand this, right? Like go to your doctor, go to your oncologist, say sequence me. And what that means is, again, just get a diagnostic test that would look to see what's driving your disease, and that's going to open up the door to either something on-label, means an FDA-approved drug that's actually fit for you. It could be off-label, an FDA drug that's for some other cancer, but you're genomically the right fit, or a whole cacophony of clinical trials that would be a better option for you. And so we started Sequence Me. It's a movement. It's a patient-driven movement. SequenceMe.org. You can get this baller shirt and then wear it.
Baller.
and then wear it to your doctor's office, demand it. And we're also bringing new tools to this platform. So we recently launched a chatbot, an AI chatbot. It's the first genomic speaking AI chatbot that can educate a patient on what genomics is for cancer.
So somebody who's going through a treatment right now and hearing what you're saying but doesn't have any base to understand, we can go to the chatbot and just
get a chatbot.
Hey, what is this?
Yeah, what is this? And eventually we're going to make this chatbot just super seamless. We'll probably integrate into a couple big labs so you can just get tests ordered real quick.
Wow.
If you have a doctor that's not supportive, doesn't matter. Put in your zip code, boom, we'll hook you up with a doctor who is.
Why, I just have to ask really quick, why is it that the medical industry is so reticent to get into this?
Yeah. So,
I mean, I'm sure that's a big, broad question, and maybe that's too much for right now, but...
Well, so what I would say, when I first did this in 2015, it was wild, wild west. There really wasn't. Academic cancer centers like OHSU here in Oregon were doing their own tests.
Okay.
You had a couple, other big academic cancer centers that were coming up with their own way to, diagnose people this way. Now you have big, well-funded corporations like Foundation Medicine in Boston, who has a FDA-approved, Medicare-covered test that you can order and get Medicare to cover it.
Wow.
Tempus, Eric Lefkowski from Groupon started Tempus, right?
Yeah.
So they're doing some super innovative things over there too. So you're seeing these commercial diagnostic companies along with academic cancer centers all come up. They see this data. This data is like the new oil. You need to have this if you want to discover new drugs, find the unmet need of mutations and biomarkers that we don't know how to treat yet. This is the future.
Yeah.
And unfortunately, 85% of cancer patients still go to community hospitals where they bump into a doctor who may not even know how to spell genomics.
Wow.
Right? So you have to push it from a patient perspective, I think.
Well, and that's why this is such a great thing that you're doing, is bringing that power to the patient to understand, and to make the movements themselves. And I want to give everybody that information too, because we probably all know somebody who's been affected by cancer. I mean, I'm sure all of us know that, and including people who are going through it right now. I mean, I personally do. So I'm asking, where do we direct people?
Yeah, so I would say first and foremost, if you have advanced cancer, somebody with advanced cancer, and they are not getting this type of diagnostic to open up new doors, then send them to sequenceme.org.
Okay.
That'd probably be one simple place to go where you can learn about this. We have a battle card that you can actually print out and bring it to your doctors. And when the doctor says, what? Why? Well, then just walks you through how to handle that, right?
Wow.
I think if you live in a big city, go to an academic cancer center and demand it, right? So here in Oregon, OHSU is a perfect example in Portland, but every big city has one. If you don't, just go to your community hospital and say, I want to get my tumor DNA tested. I want the DNA of my tumor tested. They can farm it out to these commercial places like Foundation Medicine, Tempus, other places. Within 2 weeks, you get results back, and it'll open up new doors.
And you'll have a better idea of where to go.
Yeah, and a better idea of what is uniquely driving your specific cancer, because everybody is unique.
Well, I mean, thank you for doing this.
Absolutely.
This is great work, and it's certainly something important. And we love talking about technology that's helping people out, but this is utilizing all this data for something good.
Exactly.
Power to the patients.
Exactly, and I think it's just going to be someone like me too. Like I feel like I'm on the leading edge, the bleeding edge of this right now. But 3 or 4 years from now, everybody's going to be moving this way.
Yeah.
And then you're going to imagine how much data will be out there when that many people start doing this.
Yeah.
And now you need things like AI to find the hidden patterns, the unmet need that we haven't been able to see with our human eyes. I mean, it's just going to be revolutionary. And I don't know. There's never a good time to get cancer, but now is better than it was before. That's for sure.
And that's all you can hope for, right?
Yeah.
That's the best thing. Well, Bryce, I want to say thank you so much for joining us. Very inspiring, and really appreciate the work that you're doing.
Thanks.
And I want everybody to go there. So sequenceme.org, the best website. Take a look there and check out what they're doing, and certainly share that information if you have anybody that's affected by cancer. I mean, this is really important stuff. So thank you, everybody who's watching live right now. This is part of the fun thing about this show. We get to talk about all kinds of different topics, and I appreciate everybody who's joining in. We are broadcasting live, and coming up next, we're going to be talking about some Tetra VX, talking about cloud-based solutions, different ways to connect people. So all of that's coming up. We have so much to talk about. Back here in a minute with more Digital Trends Live.
Apollo 11, your go for separation.
TV is making history again. The groundbreaking Samsung QLED 8K.
Welcome back to Digital Trends Live. Again, we're broadcasting live across a number of different platforms, and we appreciate everybody's tuning in, dropping your comments and questions as we go throughout the show. And I'm Greg Nibbler, and I'm going to guess that some of you out there watching right now are working remotely. And that's something that's certainly a trend that we're seeing a lot in the marketplace. And how do we connect people? How do we make sure that those connections are still working no matter where you are? And that's something that, in part, we're going to be discussing right now. Joining us, we have James Carroll, who's the partner and director of sales and marketing at Tetra VX. Hello, thanks for joining us.
Hi, Greg. Thanks for having me.
James, I wanted you to give everybody just a little bit of context. Can you walk through what Tetra VX is?
Sure. Tetra VX is about a 20-year-old UCC organization, so that's Unified Collaboration and Communication. We've been providing on-premise as well as cloud-based solutions in 3 different verticals, so around the platform for Skype for Business, Cisco, and our own homegrown IP. We also have an integrated collaboration solutions group, which kind of merges the collaboration aspect of video content with the UC platform. As we've seen that kind of get closer and closer in the last, say, 4 or 5 years, those lines have been blurred a lot. So we start to just see those endpoints on the video collaboration aspect just as important as the handsets when delivering unified communications.
Yeah, and video collaboration. I mean, I think for all of us out there, it's more and more prevalent in office spaces. I mean, we use it here all the time, and I'm sure that's not a unique case for digital trends. So talking about, with, as you mentioned, UCC, so unified communication and collaboration, and bringing all of that together. Where are we at right now? So I guess seeing this proliferation of video collaboration, but where is it really in the marketplace? Where do we see this going for the next year?
The video collaboration aspect really becomes a better way of communicating across the platform, either directly with your end user customers or even internally.
Okay.
We see it in specific verticals like legal, where they're now using it to take depositions as opposed to flying lawyers or clients back and forth. We also see it in ways of doing cost savings in enterprise for travel and entertainment. The one-to-many type broadcasting solutions that you see, where an individual wants to talk or message to their entire organization, you can do that now. Video collaboration is in that spot. But what you're seeing is also it become more and more granular to the actual end user, a one-to-one conversation on how can I collaborate with you specifically, whether that's desktop share or video conferencing. And that evolution continues to grow, and it gets easier and easier even in mobile formats, not just in the office space.
And you're talking about a lot of different ways it's being utilized, and I feel like that adoption rate is increasing. So as we see this more, I guess, going back to something that I brought up at the beginning, which I feel like is a trend, and maybe you can speak to it, is the trend of working remotely. It seems like a lot of people, and especially younger generations, this is how they want to work. They want to live in the place they love, but also work in the organization they love. And sometimes those aren't cohesive. So looking at that, how can this change that landscape? And how is it changing, I guess, as we go through this?
Yeah, I think the change has already started. I think Gartner listed that you'll see a 10% increase in employee retention rate by 2020 by adopting that work wherever, at any time, any place type mentality inside the workplace. What it does is it allows the younger generation, the millennials, to now take part in a environment where they don't want to show up every day, where they can't show up every day. And it makes people more efficient, more effective in their own ways to work, as opposed to the legacy 9 to 5 in the office in the cube type. So it allows employers to gain more from their employees because they're becoming more efficient, they're working in better models, but to keep that still collaborative, high touch type office environment by allowing them to work via video collaboration.
So as we see this happen more and more, I guess a couple of things I wanted to ask is just for businesses out there, say there's somebody who's got a business that wants to start utilizing this kind of technology more. What are the steps that they would need to take, or what would you recommend they do?
I'd recommend looking at the end user first. Yeah. How is your employee actually going to consume that technology? Every office, every culture, every business type is going to be different. So if you don't take that first step and try to identify how is this going to positively impact the end user, their experience, my client's experience, and then obviously hopefully generate revenue for the company, you really can't get to that next step, which is what should my investment be? What's the right solution? How am I going to implement it? How am I going to support it? So we very much believe that doing some type of internal discovery around how can I better empower my employees by leveraging this type of technology is always the first step. And then you'll back into whatever that proper solution is, as long as you're working with the right team or individuals.
Would you recommend that same thing when talking about your customer base as well? So the same thing, look at what they're going to be doing first.
Yeah, I mean, again, it depends on how you interact with your customers. It depends on the specific type of work you may be doing, right? So if I'm speaking to an individual that's much more B2B, that might not be as necessary as somebody that's very customer facing. We see it in the contact center now. The contact center and UC space are becoming very, very blurred in regards to where those lines are now. And as omni-channel grows in the contact center, video is becoming very prevalent, as well as what you see from social media getting kind of combined into the contact center. So you see the video aspect of that even getting into the high touch customer service areas. So for absolutely sure, understanding who your end user, who your target market is, but understanding how your employees are going to utilize it is probably the first step.
Excellent. Well, I want to say thank you so much for joining us too and talk about this and walk through. It's an exciting space, and it is fun seeing this change and the innovation in the ways we're communicating with each other. But for people out there who want to learn more about your company in particular, where would we send them? What's the best place to go?
The best place is to check out the website at tetravx.com. It'll show all the list of services and how to contact us in regards to answering any of the questions you may have across the entire unified communication and collaboration stack.
Great. Well, thank you so much for joining us here on Digital Trends Live to talk about this. Really appreciate it.
Thank you, Greg. Have a good day.
You too. All right, so interesting stuff, right? We're talking about different ways that we communicate, and this is something, since we're broadcasting live right now, I feel like everybody out there understands that. It's changing constantly, so definitely cool to stay at the forefront of that and learn a little bit of information on that. And talk about learning some information, that's what our next segment's gonna be about. We have Caleb Dennison, who's gonna be joining us here in studio to talk about television jargon. Look, there's a lot of terms that are thrown out now with televisions, and we know that they're really great, but understanding all of them sometimes is a little bit hard. What do they actually mean? Well, Caleb's gonna be here to walk us through that. He is our lifeline for that. So Caleb's going to join us here in the studio. Back here in a minute with more Digital Trends Live.
Apollo 11, your go for separation.
TV is making history again. The groundbreaking Samsung QLED 8K.
And welcome back to Digital Trends Live. Again, thank you everyone for joining us. We're broadcasting live in the Samsung QLED 4K studio, and we're live across a number of platforms, which means we can take your questions. But I have some questions right now that I feel like a lot of people are also going to have. It's when it comes to buying televisions. There's so many great options that are out there right now, but understanding all of the jargon that comes with it can be a little bit confusing, and that's why we have our own Caleb Dennison here to help walk us through this and make it easier for us to understand.
Good morning, Greg.
Good morning, Caleb.
Great to be here.
I want to start off, when we talk about LED TVs, they've been out for a while, but what are some key factors, maybe a key term that we should know when going out to purchase?
These are terms that you're going to run into if you start shopping for a TV. And a lot of people are starting to do that because they're thinking about the holidays. It's a big time to buy a TV. You're going to see a lot of jargon on the boxes themselves, on the website. and it's hard to understand how much of it is meaningful and how much of it isn't, and what makes the difference. So yeah, I want to start talking about one thing that you see a lot of is direct full array, or full array local dimming. What does that mean? So we have to start by understanding that an LCD TV it's an LCD TV, but it uses LED backlights. The old ones used to use compact fluorescent bulbs. The new ones use much more efficient LED backlights. These backlights shine through a bunch of different layers, including a color filter, and ultimately bring you the image that you see. How it does that is super important, though. So older LED TVs, when we first got the LED LCD TVs, had edge lighting. So most of them would have lights on the side, some of them on the top and the bottom, and that's it, right? Just off to the side or the top of the bottom, and they would use those lights to try and illuminate the entire screen. And you can see the problem there, right?
Right, that doesn't seem efficient.
You don't really have light where you need it. So a direct full array backlighting system will put LEDs behind the entire screen. Like this screen right here, there's LEDs everywhere behind it right now. And that helps you get a much more uniform picture, right? It also helps reduce the amount of glow that you might see around a bright object on a dark background.
Yeah.
There are a number of different terms for this, but the bottom line is if you're trying to make something in the middle of the screen bright while the rest of it is surrounded by darkness, that's really difficult to do if you just have lights on the top and bottom or the side of the screen. So basically, direct full array means that there are lights directly behind the screen, and there's a full array of them going on there that not only keeps the brightness uniform across the screen, but it also lets them control which ones are on and which ones are off. So if you have bright stuff over here, but this area is supposed to be dark, you just turn off the lights over here and keep the bright ones over here. Now, not all direct full array systems are created equal. The fact of the matter is you can have a bunch of lights directly behind the screen, but if you don't control them well, then you don't necessarily get a great picture. And what I've found from reviewing Samsung QLED televisions over the last couple of years is that they have a really great control of that technology. They know exactly how many zones they want to have for the different screen sizes that you've got, and they do a really great great control algorithm. And I guess one of the easiest way to see how well a TV does that is watch something with black bars on the top and the bottom, the letterbox bars, and then turn on the closed captions. That will let you know right away just how well the backlight control is going on. If when the captions come up, the entire lower third of the screen lights up, that's not a great sign. And again, what I found from reviewing, as a professional TV reviewer reviewing Samsung QLED TVs, they do a better job than most. That's because they've been working at this for a really long time.
That is a great tip. Actually, I've never understood that before, so that's a great way to test it out.
It's funny because the direct full array backlighting is responsible for what you see.
Yeah.
But when you're talking about the quality of that backlighting, it's what you don't see that matters the most. You do not want to see distracting things. You don't want to know that there's a backlight there, really. Right? So the best ones don't call attention to themselves at all. You just get to see the fruits of their labor, and the content is what shows through. And I think that's what really qualifies a great backlighting system with local dimming, just kind of controlling what's illuminated and what's not.
Handling that.
Yeah.
All right, let's keep talking about this, talking about some different terms. And you brought up QLED, and I think at this point we all know that the term QLED is a sign of a high quality television.
For sure.
But there's still some confusion out there versus OLED. What actually is the difference? Can you walk us through that?
Yeah, Samsung coined the term QLED a few years ago, and it's because they were kind of pioneering bringing in what are called quantum dots into a television technology. Quantum dots are, they're kind of advanced little particles, nanoparticles, super tiny particles that there's a number of different ways to use them, but the most popular way is when you shine a light on them, they react, right? So in the case of Samsung QLED television, what they've done is they've taken a sheet that is just lined with these quantum dots, these little tiny particles. And instead of using a white LED and then shoving that through a color filter in order to try and get all the different colors that you want, which is a really kind of difficult process. A dirty white light, like a pure white light, is every color in the perfect balance, and you
Right.
get white light. And then you're supposed to be able to carve out different colors by using a color filter. But it's really difficult to get a pure white LED, believe it or not. So lots of people have tried different ways of going about this. What Samsung has found is that if you shine a pure blue LED, which is a lot easier to attain than others, you can shine that onto a quantum dot sheet that has certain quantum dots on it, and it will produce a very pure red and a very pure green, so that the color filter has to do a whole lot less work when it gets involved in the process. And what that leads to is a higher color volume, right? So with the direct full array backlighting, you're able to get a higher brightness level. When you fold in quantum dots to improve the color of the television, you can actually increase the volume of the colors and the different shades of color that you can get. So you have a wider color gamut. And then also in that color gamut, you can get those colors much brighter. And what that means to the viewer is just, wow. It's a visual thing. When you see it, you know it. I mean, the fact of the matter is TVs are now producing colors that we have never seen on TVs before. There's a certain Ferrari red. Believe it or not, the freeway signs in California are a very specific hue of green, and TVs have not been able to produce those correctly before.
Wow.
So we are finally seeing a more accurate representation of real life and the content that creators are trying to make for us. So when you have that perfect amount of color volume and the vividness, you know, it really hits you.
And I know, I mean, you are a television reviewer. You see a lot of these, so I know when you're excited about something that this is legitimate. This is some really cool stuff.
Yeah, and you will find that QLED is not just on Samsung television. Samsung came out at one point and said, listen, we think this is a great technology. We do want to see other people adopt it, which is why you might see the term QLED on other television brands.
Okay.
But understand that what it means is that quantum dots are involved in some way to improve the color of the TV, give it a higher color volume and a wider color gamut. You're just getting more.
Well, talking about you know, this as far as these different terms that we need to know. So another term you see on TV boxes everywhere, and when it comes to content, as far as like Netflix or Disney Plus is even advertising this, HDR. So speaking about the colors, can you walk us through what HDR actually does and how that interacts with QLED?
Yeah, HDR stands for high dynamic range, and you might be familiar with that if you're into photography or videography, where you're trying to capture a wider range of contrast, you know, some darker darks and some brighter brights, both in terms of, you know, black and white, but also in terms of color. HDR is probably one of the coolest things that has happened to television in the past several years. 4K resolution was great, but when HDR came along, it really improved everything.
Yeah.
So I think the greatest thing about HDR is that when you see it, you realize, oh my gosh, I didn't realize how much I was missing. If you've got, you know, a picture of a black cat, you know, in a dark background, there's a nuance to the different shades in its whiskers and in its hair that on a TV that doesn't have HDR, it would just look like a big black mass. Conversely, if you're looking at a scene with, you know, a bunch of billowy clouds, maybe there's a storm out there. In the past, you would just get this very bright white sort of cast to the clouds. You wouldn't see any depth or detail into that. And what's interesting is that it's actually the backlighting system and the quantum dots that sort of feed into the performance of HDR in a Samsung television, in that they're able to give you brighter brights and darker darks, but also more individual levels of brightness, right? So it's not just like, it's not like it's bright and it's very, very bright and that's it. There are subtle different levels of that. And so it just increases the contrast, it boosts the color, and it makes the image leap off of the screen.
So fascinating. I mean, and it sounds like that combination of everything together really does give it that amazing picture, and it is amazing. Like you said before, once you see it, you know it. Talking about something else, another term and another idea with televisions is, you know, they're such show pieces now. They're bigger than ever. And when you have it in your house, you know, it's something you want to show off, but you also want it to be part of your interior design. And I know there's a term called ambient mode. And I wondered if you could explain what that is.
Totally. First, let me explain what's changed in the last few years. It used to be that we started with big console TVs, where in order to make it look more like part of the room, you put it in a big old piece of wooden furniture, right? You remember those from the old school days. You might probably watch cartoons on them, right? Well, then we moved away from those big cathode ray tubes, those CRT TVs, and we got flat panels. We had plasma TVs, which started putting this big black or silver rectangle up on our wall, or maybe just taking up a bunch of room on a, on a console or entertainment cabinet. And no matter what you do, it still looks like a big black or silver rectangle.
Right.
But the fact of the matter is these things have gotten very, very thin, very svelte. They're taking up space on our walls more often than not. And when you turn them off, they're just a big black empty space. You can do better than that. Samsung realized that you can definitely do better than that. So they created ambient mode, and this is a Samsung exclusive. You won't find it in other TVs right now. Ambient mode will allow the TV to look like a part of the wall that it's on. So if you've got it up against a brick wall, white brick wall like we have here, red brick wall, maybe you have a particular kind of wallpaper going on, or there's a certain texture to the wall upon which the TV is placed, it can actually display that wall texture, that wall color, and kind of turn into a chameleon, really, and just look like a part of the wall as opposed to a big black abyss. And that's really, really cool. And in some cases, you can also display art on these TVs. And part of the advantage with this technology is that when you're trying to display art or look like a part of the wall, you're not actually trying to look like a TV at that point. You're not displaying TV-style images. You want to tone down the contrast a little bit, make it look more like part of the room. So the TV uses sensors to read the room, know what it needs to do in order to make an image look the way it should, to be either a piece of art or just seamlessly blend into the background. And that's ambient mode. It turns into a bit of a chameleon, recesses into the background, and then when you want to watch TV, that's when it starts leaping out at you.
That's incredible. I can sense the light and actually adjust to that. I mean, that's where we're at right now. So, I mean, this is just walking through some terms. And Caleb, thank you for making this a little bit more understandable. I mean, it's an exciting time to buy a television, but also you need to know what you're talking about and what you're looking at, and this definitely helps out tremendously with that.
Awesome, man. I'm glad I could help.
And that is what we like to do here at Digital Trends, is help inform you, let you know what you need to know and why you need to know it, and that's a perfect example of that right here. So I want to say thank you to everybody who's tuning in right now to Digital Trends Live. We are broadcasting live. We have more coming up. We've got more interviews. We've got more things we're going to be discussing, more news. So stick around. Back here in a minute with more Digital Trends Live.
Apollo 11, your go for separation.
TV is making history again. The groundbreaking Samsung QLED 8K.
Hello. Welcome to Digital Trends Live. Thank you for joining us. I just want to say thank you. We appreciate everybody who's joining in here on whatever platform you are watching. We do appreciate it. So drop in your comments, your questions as we go throughout the show. As you can tell, we're live. And let's talk about some more technology news right now. There's something I want to bring you up to date on. So something that we've been discussing a lot here on the show today, and we do all the time, is talking about biomedical technology and the rapid advancements in that and different ways that it can actually help people out. And what we're talking about right now is an article that's up at Digital Trends about injectable diodes, so injectable electrodes. And these are things that you can actually put into your skin that would work. So I want to talk about this. That's a lot of technology that I just brought up right there. So let's talk about how this is. So it's basically looking at different ways we can get rid of some of the drugs that people are using to manage pain and how that is something that that people have to deal with. Well, the way this works is this technology is essentially, it's that. You would inject in this specific liquid. So what part of the problem when we've talked about different electrodes before where different doctors have tried to use this, where they put them directly in, is that it's a metal piece. It doesn't necessarily conform to something like a human body, where it's got to wrap around something, or it's soft tissue. Well, the way this works is they came up with this liquid solution that does have some metal in it, but they can inject it in. They're calling it injectrode, and that's the term that they came up with for it. So they inject it in, and as it goes in there, it then reforms exactly where they want it to go. So they can pick the specific nerve or a specific muscle tissue that they want to put this into, and it will then conform to that. And apparently you inject it in, you come back about a week later or so, and then they can also interact with it with this, what they're calling an external signal generator to target it. And it will enact it. It will actually activate that to where it can provide the stimulation that it needs to whatever the nerve is. And for anybody who's dealing with chronic pain or dealing with issues, from a surgery or something like that, this is something that can be huge. And it's taking less drugs, right? That's an issue that we don't even need to get into right now, talking about how pharmaceuticals can certainly do some long-term damage. This is a way that maybe we could get around that utilizing technology. They said, yeah, even depression, so different ways that people are dealing with different issues and different ways that these things could help. It's really incredible. So again, these are called injectrodes. We've got the article at Digital Trends, and it goes way more in depth as far as what the specific information is, but you can check that out there, injectable electrodes that could relieve pain, cool use of biomedical technology. All right, continuing on here, bringing you up to date on some trending stories in technology, some of them more advanced than others. Right now, we're going to talk about the Hayabusa 2. Let me explain what I'm talking about. So the Japanese Space Agency, this is their probe that they sent out months ago to go intersect with an asteroid. And what this did, when it actually did interact with it, so this is a 3.5-year mission, but it's been there for about 17 months, with this asteroid, and this is about 200 million miles away from Earth. And this is really pretty amazing what they've done. So it met up with the asteroid. It actually shot a projectile into it to blow up part of it, so that it could actually get in there and get some samples. It sent down probes from the probe onto the asteroid itself. And this is the first time ever that we're going to get to see some of these samples brought back. So here's what it's doing. So when it met up, June 2018 is when it actually met up with the asteroid. So it's been circling this for that entire time, doing studies, doing all kinds of different things with it as far as figuring out what's going on and collecting data. Now that it has these samples, so it actually collected rock samples, and it's taking those samples back to Earth. So this was yesterday when it officially made its turnaround, and there's showcasing actually how it's going to get those samples back to Earth. So the probe itself, the Hayabusa 2, is not going to land on Earth. It's going to shoot out this 40 centimeter wide capsule that's containing the rock samples. It's going to shoot that down onto the Earth so that it stays out in space and can actually be utilized for another mission. So they're thinking that they can actually still keep using the Hayabusa 2 once it makes its journey back to Earth from the asteroid and then send it back out for another mission. So this capsule, when it shoots down, there's one issue with that. They think it's going to land somewhere in the Australian outback, so they've got to be able to track it down and find it, this really small capsule. They should be able to do that. That's one of the challenges they're going to have. But really fascinating use of technology. I mean, just think about that. Sending a probe to an asteroid in the solar system and then bringing it back here and sending the sample back to Earth. Really incredible moment. So the Japanese Space Agency was having some pretty big celebrations over this yesterday because of the turning point. And it's still going to be a while. It's going to be about a year before it gets back to Earth. But definitely some interesting studies are going to be able to find out about that and maybe some of the origins of the solar system. A lot of scientific information going to be brought back with that. So bring you up to date on that. Check it out at digitaltrends.com. All right, one final topic here that I want to bring up, and then we're going to go to a break, and we'll be coming back here in a bit with some more information for you, some more interviews. You know what? Yesterday, at the end of the show, I promised some robots. Let's talk about some robots. Quadruped robots. Now, we see those in the news all the time with the Boston Dynamics dog, the Spot Mini, the cheetahs. This is one now actually coming from a different study, and this was actually showed up at the International Conference on Intelligent Robots and Systems. That was taking place in China over this last week, or about a week ago actually. And so this is what they were showcasing. So this is a study from the Tokyo Metropolitan University, and we have a video too showcasing this thing climbing ladders. Now, there it is. Now, it's kind of stop motion animation because it's not moving super fast, but this is actually a really big achievement. Now, if you think about it in nature, and they actually brought this up in the study, dogs, there's all kinds of videos of dogs climbing ladders. Usually they're at an angle because it's very difficult to do, and it's not something that you're going to see most dogs do. But going straight up is a real hard thing to do because of the balance that you have to have. You have to have very strong gripping utensils there at the end, or feet, if you want to call it that, on the robot. It's got to be able to grip, it's got to be able to balance itself, and it's got to be able to manage all of that. And there's so many different factors and outside inputs while it's doing it that it's a difficult thing to achieve. But now they're showcasing that they can do that. Of course, it's, if you're like me and you watch too much Black Mirror, this is not something that you necessarily want to see because you go to the dark places. But it's probably a good thing. And it's a good use of technology, something that's pretty cool that they're working on. That's from the Tokyo Metropolitan University. And we see so many advancements in robotics constantly. I mean, every week it feels like we get something new. And it's always interesting to see where it's going. So that's something that they're working on, is adding some more dexterity to what these quadruped robots can do. Read about it at digitaltrends.com. All right. Here's what's happening. We've got some more interviews for you. We've got more things we're going to talk about. Real news is going to be coming up. We're going to bring up to date on some movies that are coming out this weekend. We're going to take a break right now. We'll be back here in a minute with more Digital Trends Live.
Apollo 11, your go for separation.
TV is making history again. The groundbreaking Samsung QLED 8K.
This is Digital Trends Live. I'm Greg Nibbler. Thank you for joining us, and we appreciate everybody who joins in with this show. It's interactive. We want to know your comments and questions, and we'd like to keep you up to date on cutting-edge technology, and certainly 5G is something that's going to change everything for us, and we're starting to see 5G phones roll out. But what about the infrastructure needed? How are we going to actually get that signal to everybody? We're going to talk about that in part right now. Joining us, we have Dror Dene, who is the Chief Business Office of XJet Officer, and thank you so much for joining us here today.
Thank you. Happy to be here.
So I want to give everybody an understanding. Can you tell us what XJet is?
Well, XJet is a company that makes 3D printers. The unique thing is our 3D printers or additive manufacturing systems can create metal or ceramic parts for a variety of uses in a very unique technology that is based on liquid rather on the traditional powder systems that were used the past decade or two to create metal parts.
So I imagine that as I guess it would be coming with 3D printers, it allows an extreme amount of customization to find unique solutions for things that are going on. And 5G, certainly the telecommunications industry is trying to figure this out. And just to give a little bit of context for that for everybody, depending on what kind of 5G you're using, you need a lot of towers, a lot of antennas, a lot of ways to transmit that and get that to people. It's extremely fast once you get it, but that part's a little bit difficult. And so figuring out solutions to that has been challenging. And I know that XJet is working on some different ways to get around that. Can you talk about some of those solutions that you're coming up with?
Absolutely. The uniqueness of this solution, there are systems that may enable the 5G communication. The problem is that they are either extremely expensive, like phase array technology, or including some mechanical parts like radar. The idea of the passive antenna that was developed by some of our users is to use a ceramic structure which is extremely detailed, extremely clean, to allow a passive steering of the electromagnetic beams. So it requires a new level of 3D printing. We are talking about, first of all, it has to be ceramic, because the ceramic is the material that allows the diffraction of the electromagnetic waves or the signal. So we can divert the signal in all directions in a passive way, just by the fact that the ceramic changes the direction in which the beam is moving. In addition to that, we have to build it. It's a small contraption. It has to be extremely accurate, and it has a lot of details. All of that also has to be extremely smooth, and this became possible with the invention or the innovation of the soluble support that we introduced recently. You could see it in the video. The support is basically a different material that is completely soluble, which means that it can be removed even from the tiniest holes and inner cavities, which means that you can end up with a very complex part that can serve as a passive antenna.
I think that passive side of it is very interesting. So this isn't something that would have to be powered, which clearly would reduce some of the cost, if I'm understanding it correctly. If it's passive transmission, you're hitting this, it sends the waves out, and that's and again, my technological terms for describing 5G may not be the best here, but understanding it from a layman's perspective, yeah. So the passive side is great. So this customization is huge. So where are you at right now when it comes to these antennas, and how do you get this out into the field?
Well, the big breakthrough came from the University of Delaware. They created, before they even met us, they created a software simulation that basically built a small half dome, not much bigger than a typical mouse of your computer, so slightly bigger. And inside you have inner tubes that have either the ceramic or emptiness or just air. This allowed them to divert the communication to the exact direction that you want. So this existed even before we met, or before the University of Delaware came aware of our technology. The missing piece was the ability to print this device, this relatively small device that has a lot of small tubes, very, very thin holes, to print it as one single print in one piece. And this allows them to actually change this simulation into something real. This is not the end, of course. There is still a need to have the transmission of the information. So the project itself will include additional partners which will make it real.
Well, taking a look there and looking on screen and looking at one of these printers, so where are they being utilized, I guess, right now? perhaps some examples of it. And I know that there's some other things other than 5G antennas, as we were discussing, because of the customization that you can make with this. What's one other use case that we could let people know about?
Well, there are quite a few. Well, the machines are installed here in Israel. They're installed in North America now, in the United States, and in almost 10 countries in Europe. In terms of the application, one exciting application also coming from the United States, from Madison, Wisconsin, it's a small company that managed to plan a small contraption that will be added to MRI, magnetic resonance imaging, MRI system, and to allow determination of tumors in a breast cancer. You can, with the MRI, find very, very small tumors in a very early stage. The challenge is how to remove them. The idea of the team in Madison, Wisconsin was to actually freeze the tumors when they're very, very small and suck them out. And they needed a contraption that will be small, but very long, but very narrow, with very, very thin channels to allow the material to reach the exact location of the tumors as found by the MRI. And once again, this is another interesting case of how additive manufacturing can make the impossible possible. They took something and they worked about it for many, many years. It's over a decade. They planned it, they made the computer simulation, but when they looked in the AM industry, they looked for a device that on one hand can print ceramic. Because of the magnetic field in the MRI, you cannot use metal or other materials, but yet to enable the geometry to be printed precisely with all these very, very thin holes and small channels. And now with the printer that you just showed earlier, you can do that. And the printer is already installed there, and they're in the process of getting the feasibility studies, which are going well, and later on all the approvals to make it something that could possibly save, just to illustrate that breast cancer kills 500,000 people, 500,000 people a year. And this may create a solution that will solve the problem, not overnight, but a solution that can solve the problem and remove it in a way that is affordable.
Yeah. And I think, I mean, and that's incredible. Talk about a great use of technology is to help save people. Like you said, so many people are affected by breast cancer, and if this is something that can do that, and that's what you're able to do with this kind of cutting edge technology, is able to print something like that. And it's really fascinating stuff. And Dror, I want to say thank you for joining us here on Digital Trends Live to talk about this and walk through some of these really cool advancements. We really appreciate it. And I want to tell everybody, you can check out XJet and some of the different projects that you're working on, and go to the website. And Dror, thanks for being here on Digital Trends Live.
Thank you very much. It's been my pleasure. Thank you.
Thank you. Yeah, really interesting. So again, 3D printing, we're just at the edge of that too. Talking about being on the edge of so much when it comes to technology and different ways that we're figuring out how to utilize things like that. We're going to talk about some more cutting edge technology. In particular, we've got from IEEE, we've got Karen Panetta, who's going to join us. We're going to talk about a report called Generation AI, and that is the kids who are growing up under artificial intelligence and cutting edge technology, and what some of the studies have found in relation to that and how they relate to the world. So we're going to cover that and a lot more, all broadcasting live. So stick around, back in a minute with more Digital Trends Live.
Apollo 11, your go for separation.
TV is making history again. The groundbreaking Samsung QLED 8K.
Hello, this is Digital Trends Live. I'm Greg Nibbler. Thanks for watching. We are live, and we appreciate everybody who is joining the show here and joining in the conversations that we get to have, and it's always fun discussing this. And now we're going to talk about some artificial intelligence and actually a study that's out talking about how that's actually affecting people and people raising their kids. And it's so much information that we're going to cover. And to do that, we have joining the show once again from the Institute of Electrical and Electronic Engineers, or IEEE, we have Karen Panetta. Hello.
Hi, welcome. Thank you so much for having me.
Yeah, it's great to have you on the show. And this is such a fascinating thing to study. I did not know a lot of information about this, or didn't really think about this generation that's being born right now or growing up right now, and how tech influenced it really is and what that means. And so there's this study out called Generation AI 2019, the third annual study of millennial parents and Generation Alpha kids. So can you walk us through what this study is really about and who the subjects are?
Sure. So it's looking at millennials ages 28 to like 31 and who have children under the age of 9, and asking them how comfortable they would be with certain types of artificial intelligence in their home, or taking the place of maybe healthcare, or even, caring for their parents. So we looked at different varieties and categories. One of them was artificial organs. Another one was looking at whether you'd want a self-driving vehicle taking your child to school. The other one was that I looked at was whether you'd like smart furniture, like a recliner or a smart toilet seat in your house. And the last one looked at things more like elderly care and how you feel as you age, whether or not you would trust AI to essentially take care of you in your old age versus your own children.
Well, there's so much technological innovation and work being done in each one of those cases that you just mentioned. We've talked about them here on the show before, just how people are applying artificial intelligence to these things. So let's walk through some of the results, because I'm really curious what they thought about some of this. Maybe talking about the autonomous vehicles, like somebody driving your kid to school in an autonomous vehicle, not somebody, actually the vehicle doing the driving. What were the general feelings on that?
So it depends on the country. So here in the US or the UK, they're really not that comfortable with it. But in China, Brazil, and Asia, they are. So it's kind of interesting that the different populations would entrust their child to go to school, in a self-driving vehicle or a bus. Now, as a parent, I look at that and I say, no way, because kids misbehave on buses, things happen on the bus. So if the vehicle's just focusing on the road, then, what's going on behind you? Who's watching that? I think that a lot of people know that in the US. Maybe they're better behaved in other countries, but I don't. I know I'd want a human being watching my kid.
I can say for myself personally, I rode the bus to school, and yeah, it was good that there was an adult there. I got in some trouble. So that's a good point on it. And that's interesting, though, that some of the other countries they're completely fine with it. And I'm sure there's a lot of psychological examinations we could do associated with that. But that's one study on AI. What about some of the other ones, some of the other results?
So some of the other results are very similar. The US and the UK seem to be aligned very closely. So a lot of people, when they get older, would love to say, yes, I would love an AI assistant in my house to help me keep independent living and not be a burden on my children. And that could be everything from remote monitoring as well as, someone to remind me to take my medicine. So telemedicine, things like that. So that wasn't so surprising. One of them that was surprising to me was the artificial organs, being able to, would you allow, if your kid was in danger and needed a transplant, would you allow a 3D printed artificial organ? And again, a lot of this technology is being developed right here in the U.S. So I was kind of surprised that, unless there's a do or die situation, a lot of people in the U.S. really weren't that comfortable with it. Where in, again, China and in Asia, they are.
That is so surprising to me.
Yes, it was in India as well. I think a lot of it, the total was about 41% were very extremely comfortable with it overall. But again, when you look at the breakdown, the U.S. said if it was tested properly and, had some, approvals, if it's a decision between, your child's life or not, then they would do it.
Right. Well, I mean, you would hope so in an extreme case like that. But even before that, I mean, there's so many incredible advancements going on. It's just, I guess, it says a lot about just public opinions and how you change those and how they change through time and what it would take for somebody to change that up. So there's a couple of examples. Again, the entire study's amazing, and this is the third annual one. What's one more that you'd want to showcase that you found interesting?
I like the smart furniture.
Yeah.
One of the biggest problems right now with all this, in-home telehealth, the things they're supposed to be monitoring you, are compliance, getting, the patient to actually get on the scale, to actually take their own blood pressure.
Right.
And looking at some of these smart devices could allow you to do that without you, physically saying, oh, I have to, get on this device and do this activity. So, a smart recliner was one of them that we asked people with. And that had universal appeal, as everybody said, yes, I would be happy with a piece of furniture in my house that would do my monitoring of my vitals and things like that. And, there was on our site, we also have, smart toilet seats that are looking at cardio health and things like that. So they're trying to come up with ways without you knowing or having to deliberately take an action. You're going to lie in bed, you lie in your recliner. So the measurements happen essentially without you knowing. And I think that's a smart way to approach it.
So as long as you don't see or feel like the artificial intelligence is doing something, then then they're fine with it. They're fine with that data. Fascinating. Well, this study, like I said, it's out. It's the third annual one. For people who want to dig into it and really find out more about it, what's the best place for them to go?
So transmitter.ieee.org/health-2019. So that you can look at all the different categories, and you can see about the smart recliners and smart toilet seats, and as well as maybe your future of artificial organs. So it's really super exciting, and I hope everybody enjoys it.
Yeah, I mean, it's a great time too to just analyze yourself. Just think, okay, well, what am I comfortable with? Actually, now that I'm proposing these questions, well, that's really great. And Karen, as always, really appreciate you coming on here. Appreciate IEEE too. We cover a lot of what you all do, and thanks for being here on Digital Trends Live.
Bye.
Bye. All right, so always interesting information and thinking about how we're utilizing AI and what that means for you. Yeah, fascinating discussion, so discuss amongst yourselves. All right, here's what's coming up next. We're going to take a break. We're going to come back. We have real news with Riley Wynn and Aaron Keeney, and they're going to be talking about what movies are coming out this weekend, what ones you should watch, and that's coming up right after this break here on Digital Trends Live.
Apollo 11, your go for separation.
TV is making history again. The groundbreaking Samsung QLED 8K.
Hi, I'm Erin Keeney.
And I'm Riley Wynn.
And this is Real News, the show that helps you decide what movies deserve your money at the box office this weekend. Mark Ruffalo stars in the real-life story of a real-life attorney who takes on one of the world's largest corporations after uncovering a very dark secret. Here's a first look at Dark Waters.
Her grandson's some fancy environment lawyer down in Cincinnati.
I am a corporate defense attorney.
So?
I defend chemical companies.
Well, now you can defend me.
How many did you lose?
190.
190 cows.
You tell me nothing's wrong here.
It's a small matter for a family friend. Help a guy who needs it.
The farmer or you?
This film is based on Rob Bilott, the former corporate defense lawyer who fought DuPont, the company he actually worked for at the time. Yeah, it's crazy. He fought against them to expose the environmental hazards of unregulated chemicals. In the film, he uncovers a dark secret that connects to a growing number of unexplained deaths from a contaminated water source in West Virginia to one of the world's largest corporations. But while trying to uncover the truth, he finds himself risking his career, risking his family, and even his own life. The film, though, condenses the daunting 20-year legal battle into just 2 hours, so don't worry, it's not going to be a 4-hour film, crazy long. Ruffalo stars as Bilott, Anne Hathaway as his wife, Sarah, and supporting performances from Bill Pullman and Victor Garber.
Well, Mark Ruffalo not only stars in this film, but he produced this film as well from Focus Features. And he's been an outspoken advocate for the environment for years. I feel like his entire life. I've always seen him fighting for environmental causes. But after reading a New York Times Magazine piece about Bilott, Ruffalo reached out to the attorney and talked to him about adapting the story. He said what he wanted was he wanted to tell a story about people on the front lines. And what was really riveting to him was this tension, like you said, between a corporate defense attorney who kind of became DuPont's then worst nightmare. You probably know the actor founded the nonprofit organization Water Defense in 2010. So this partnership and his passion for the story are really in perfect alignment. So Todd Haynes is the director of the movie. He also directed the film Carol. Do you remember back in 2015? Yeah, a lot of Oscar nominations for that one. And they shot Carol too in Cincinnati, like they did this movie. So this was a very familiar setting for him. I'm like, he probably did a lot of the scouting already for that film. And Tim Robbins too, like Ruffalo in this film, he is known for his political activism always, and he said he had a personal connection to this movie because he said Bilott actually convinced him to get Teflon pans, like the Teflon, out of his house when he was raising his kids. So he thinks the attorney made a great public service, and he was really excited to share his story.
Yeah, Bilott was really skeptical of the accuracy of this film, but the team did a great job at being accurate and being truthful to his story and his life, to be honest. These actors and crew were so dedicated to being as dialed in as possible with adapting the story. Like you said, they shot it in Cincinnati, and they even casted local Ohio actors. They were able to get access to the offices where Bilott actually worked, and they even filmed real-life people from this story with cameos. So Bilott's in the film, and so is his wife, Sarah. This movie combines two of my favorite genres, legal thrillers and real-life events. I've said that before. Yeah. I love stuff that's based on true stories. And this is about a lawyer who's risking his career, risking his family, and even risking his life, protecting us from these big corporations. Yeah. You know, I think Bilott will really like the film. Yeah. I think he'll like how it turned out, and I think audiences will too.
Yeah, well, of course, this has a very Aaron Brockovich feel to it, and I saw that movie about 85 times in the theaters when it came out, so I'm definitely seeing this. The David versus Goliath films always get me out to the theaters. And Ruffalo says, too, that he hopes this starts a broader conversation. You know, he wants people to know what's happening to them, and if you're the type of person that likes to go to the theater and then get a little more research, you know, on a real-life story, there's a documentary, The Devil We Know, that came out, I think, just last year. It's on Netflix. And also Bilott's book, Exposure, just came out last month. So a lot of material there, yeah. You can dive into Dark Waters in theaters November 15th. Next up, a political thriller about the CIA's use of torture in the wake of 9/11. Here's a preview of the report.
Morning, Dan.
Morning, Senator.
Have you seen the story today in the New York Times?
Evidently, the CIA destroyed tapes of interrogations of Al-Qaeda detainees.
I want to find out what was on the tapes and why they were destroyed.
No paper.
Paper is a way of getting people in trouble at our place.
At our place, Papers how we keep track of laws. Last night I found this. He's detainee number 24. Have you guys used this thing before?
No, we watched your video.
Adam Driver plays an FBI agent who performs an exhaustive investigation into the CIA's use of torture on suspected terrorists in the aftermath of 9/11, when the CIA adopted new interrogation techniques, which might be a little sketchy.
Yeah.
Driver leads the ensemble cast as Agent Daniel Jones, the Senate staffer who wrote what became known as the torture report. Annette Bening plays the battle-hardened U.S. senator who employs him and, for the most part, has his back throughout the whole scandal.
Yeah, well, this is an Amazon Studios original film, and it premiered first at Sundance earlier this year, then later Telluride, where it received positive acclaim, and as you can imagine, sparked a lot of discussions. Well, this is the directorial debut for Scott Burns, so you might not know that name, but you certainly know his work. He's a highly regarded and really prolific writer in Hollywood. He's written a number of Steven Soderbergh-directed films, Contagion, Side Effects, The Informant, and more recently, just this year, The Laundromat. Well, this time, Burns is writing and directing with Soderbergh as producer on the film. Yeah, so I think we're in pretty good hands here. The story is complex, very complex. It's a complex issue. There are a lot of characters. It's covering a span of many, many years. But early reviews say the success here is that Burns and in this film, they never dumb it down for the audience. So they're giving the audience credit for being smart, letting us use our brains, which I think is really refreshing.
Yeah, I'm really excited to see this movie because it reminds me a lot of a movie I just saw, The Post with Meryl Streep and Tom Hanks. I love movies that uncover huge scandals, especially government ones. Those are always fun to learn more about. Conspiracy theories always come out of them and things like that. Also, Adam Driver's like one of my favorite actors right now. Every movie he's been in, I've really liked. Star Wars, This Is Where I Leave You, Black Klansman, and now The Report.
Yeah. Well, Adam Driver is Emmy nominated, as you know, and recently Tony nominated for his return to Broadway this year. So this guy is so multi-talented, but definitely worth mentioning, especially this Veterans Week. Did you know that he is also a military veteran?
I did not.
Yes. Well, he was in the Marines. That was really his first love. He thought he would be a career Marine. An injury kind of knocked him out of that and put him in a different direction. But now he and his wife, Joanne Tucker, founded Arts in the Armed Forces. It's this really great nonprofit organization that brings arts programming to active duty service members free of charge. Veterans. Yeah.
That's awesome.
Yeah. Well, the report comes out in theaters November 22nd. If you're looking for more of a fun escape at the theaters this weekend, this next film, fueled by girl power and a fierce sisterhood of spies, is your movie to see. Let's take a look at the newest Charlie's Angels.
How'd that feel? Because it looked like it felt really good.
That felt nice. We in it together, but don't call me angel.
This is the third installment in the Charlie's Angels franchise, based off the story from the original TV show back in the day. There was also 2 movies made in the early 2000s. The next generation of Fearless Charlie's Angels stars Kristen Stewart, Naomi Scott, and Ella Balinska. They work as private detectives for the mysterious Charles Townsend, whose security and investigative agency is now global. So think about it. There are Charlie's Angels all around the globe now.
Very cool.
And to go with that, there's even more Bosleys too.
Cool.
When a systems engineer blows the whistle on a dangerous piece of technology, all of those Charlie Angels teams from around the globe have to come together, they get called into action, and their lives are on the line to protect society. We also have Jaimin Hansu and Patrick Stewart, who play a couple of the different Bosleys. And then we also have Elizabeth Banks back. She's a former Angel, and now she's a mentor.
Oh, very cool. Well, Banks not only stars in this film, she is the director, she is a producer, and she wrote the screenplay for Charlie's Angels. So she kind of does it all. Well, Sony opted to reboot the franchise in 2015 after the cancellation of the 2011 television reboot. Do you remember that one?
Oh, yeah.
And they said this kind of, turned out to be more of a continuation of the franchise story and less of a reboot. But they did get Drew Barrymore, too, on board. Drew Barrymore, who was in the other films and produced the other films, and she signed on as executive producer for this movie. They kicked off production in 2018, and they were all over Germany and in Turkey, and the stars said they just had a blast, which I would imagine, and bonded very quickly on this shoot. Elizabeth Banks has really established herself as a behind-the-scenes force in Hollywood. If you remember, she produced 2 of the Pitch Perfect films and also directed Pitch Perfect 2, and she was recently awarded the Will Rogers Features Pioneer of the Year award, the first female director actually to receive that award. Yeah, and she said that 2019 just felt like the perfect time to do this movie. I think we can all agree these are very trying times right now, and she wanted to show women at work, sisterhood, camaraderie, and still in 2019 showing all that women are capable of. She also said the original Charlie's Angels inspired her as a kid. Like many of us, she watched the Charlie's Angels. She has two sisters, so they always took on the roles of playing Charlie's Angels. She said she always played the Kate Jackson role, and as you mentioned too, Banks also, she plays a former angel turned mentor in this movie, and she said that that's an intentional message in this film. She said once you turn 40, we don't kick you out. So listen up, Hollywood.
I'm excited to see this movie because I love the Charlie's Angels movies from the early 2000s. It's right when I was growing up. And this film makes a few callbacks, not just with Elizabeth Banks, but they have some fun Easter eggs. There's this one scene where they go into the Charlie's Angels closet to look for new disguises. And you'll see in the background that there are some of the famous disguises they had from the former films.
Cool.
So fun little Easter eggs there, here and there. Also, who doesn't love badass women kicking butt on screen? Come on.
Yeah, that's a home run. Well, not only do they have amazing women on screen, also behind the scenes on the soundtrack, Ariana Grande was the executive producer on the soundtrack, and we're going to hear from a whole roster of female superstars. Miley Cyrus, Lana Del Rey, and also the Shaka Khan is on the soundtrack. Yeah. Well, Charlie's Angels hits theaters November 15th, and be sure to stick around for the credits for some surprise cameos.
Ooh, can't wait. Well, if you're going to see one movie this weekend, make it Charlie's Angels. You can get your tickets at Fandango.
Thanks for watching Real News. We'll see you right here next week.
Welcome back to Digital Trends Live. All right, so thank you to Riley and Aaron for Real News right there. Some great movies to watch this weekend. And we have covered a lot of technology here on the show today, just like we do every single day here at Digital Trends Live. We bring you all kinds of tech news, interviews, headlines, discussions that you can't find anywhere else. And tomorrow on the show, we have a lot more for you here at Digital Trends Live. Ciara Pressler is back for Pregame HQ. She's here for the work-life discussions about how to stay creative. Even if you're not a creative professional, all jobs require creative problem solving, and she'll provide some tips for staying relevant and responsive to the ever-changing market. And if you've ever wanted to push your Instagram post to Twitter, you probably come across If This Then That, IFTTT. It's a platform that connects apps to other apps, automating processes, and we're going to talk to the CEO, Christopher Gabarian. And Ken Young, of course, will be here for our weekly Tech Briefs, which is our edition with the technology editor from Flipboard, where we rehash some of the top headlines from the week. And Luke Larson will be on unboxing a new Alienware gaming desktop PC that you'll for sure want to tune in for. So all of that and all the technology news on Digital Trends Live here is every single day. You can catch us every Monday through Friday at 9 a.m. Pacific, noon Eastern, wherever you consume content. And we will be back tomorrow with another edition. See you then.